All right, everyone. So we are doing the fourth recording. And so you went through how to answer any multiple choice questions. I hope that you're really doing that method and applying the 3 skills. Those are the only 3, okay? So listen, you're gonna get books that have 20 tips to answer multiple choice questions. You only have a minute and a half. So what could you do really? Then you went through the concepts, the top most important concepts. Then the third video was a review. And if that review doesn't get you there, I don't know what will. We covered all the most important things for CNA topics, and that will get you to pass the exam. So now we know that the exam is in 2 parts. It is the multiple choice, which we delved into, and the clinical skills. So what I'm going to do, I'm going to open a couple of things. Don't be overwhelmed by clinical skills. So in the United States, there are 3 companies that test, or maybe 4. So there's Prometric. So my school is located in Massachusetts. Massachusetts have been through all of them. It was American Red Cross testing, then Prometrics, and now DNS, right? And so I'm telling you, I've went through all of them. Some will have an additional skill versus another one. Look to the specifics of your state, but they all cover the core things, right? Because if you know how to wash your hands, you know how to wash your hands, okay? If you know how to make a bed, you know how to make a bed, all right? So you look at the specifics, but once I give you the principles. So this video is going to be based on the skills, knowing the principles so you do not get overwhelmed, and so that you're able to perform any skill. Okay, so with that said, a couple of things. Let me share screen. I want to take you to my YouTube page. I want to take you to my YouTube page, and these are, just open to the public. It's Nurse Stephanie Victoria SV here, and then you'll know by Healthcare EDU banner at the top. I created this page as a supplement for my students, but of course everybody else, because YouTube's open to the public. And so once you go on here, there are plenty of skills, the wheelchair skills, there are map skills, but anyway, pretty much, especially for the state of Massachusetts, all the skills that we go over, I'm trying to find one, ambulate with a wheelchair, all of it feeding. So you just have to go through because some map things are embedded in there as well. So here's compression stockings. So there are plenty of videos. I would love for you to like and subscribe to the page. And again, you'll be able to watch me perform the skills as well as us narratively going over it, okay? So let me stop. And then now what I want to do is open the ebook. This is your CNA notebook. It's more like a workbook as we've gone through it. I'm going to open that and share screen to go over a couple of things with you. Okay, so this is your ebook. So you have it. Hopefully you've printed it out or open it on your computer. But before we get into principles, so how I'm going to break this down, you saw I just showed you the YouTube page where you could actually watch me do the skills and practice, but now I'm going to help you break it down into kind of concepts, okay? So before we get into the skill, I want to show you every skill has a beginning and an end, and the beginning of every skill is the same, the end is the same as well, okay? So let's talk about the beginning steps of every skill. And what you should actually do is just commit this to memory. It's in your notebook, but just memorize it so that you're aware. So let's visualize and think about it. You're told to bathe a client. Use soap and water hand wash, right? So the beginning is not Purell, it's an actual hand wash. And I have a hand washing video up. You gather your supplies. So what you need to do is actually make flashcards for all of the skills. the supplies that you need to bring in, okay? And do I have that on the video too? So the supplies that you need to bring in, you need to make flashcards for those, okay? You knock on the door. All right, so the knocking on the door covers the right to privacy. So remember, patients have a right to privacy. You announce the following: your name, your title, and explain what you're doing. So patients have a right to know, they have a right to make choice, decision-making, what you're doing, etc. Then you close the privacy curtain, which is again adhering to the right to privacy, and you check the 2 patient identifiers. This is your safety concern to in fact ensure that you have the correct patient, okay? So if you go through these, a lot of indirect skills. So indirect means that although they assigned you to making a bed, and that's the actual skills, they indirectly are giving you these tasks, which is safety, privacy, infection control, and such, okay? So this is infection control. I have my pen here. So this is the hand washing is infection control. Now under the hand washing, I don't need to do my scribble. Under the hand washing, you actually, one thing I tell my students too is that when they are by the sink washing their hands, there's a separation between your person, your scrubs, and the sink, okay? So that it's clean and dirty. You keep a space there so you're not leaning up against the sink. And I talk about that in the video again too. So right to privacy. So these are indirect skills, okay, for concepts. And going back to the concepts, remember they're always going to give you the concept of infection control, etc., etc. Okay, so that's beginning. Now let's talk about finishing up steps for every skill. So you're just going to memorize the beginning steps, and then you're going to memorize the finishing up steps. So you're going to make sure whatever they're in, most of the skills, the patient's in bed, but even if it's the wheelchair, it could be the wheelchair, but you're going to make sure whatever they're in is in the lowest position and locked. That's safety. You would never leave the room, leave the bed unlocked or the wheelchair unlocked or the chair unlocked or the commode unlocked, okay? The call light is within reach. That's also safety so that if they need you, they can call you. The side rails are up. Now, there's some controversy with the side rails. Prometrics, for example, didn't penalize you if you didn't do the side rails. So depending on your state, even if you use the side rails and keep them up, they won't penalize you, but it's better to put them up than leave them down, and try to remember what your state does. So put them up when you're done. And even if your state doesn't count that, you won't be penalized. Patient comfort, meaning are you comfortable in the bed? Are you comfortable in the wheelchair? Whatever they're left in. Remember, when you were doing the skills, you had the privacy curtain, closed, but now you open it, right? Clean and return supplies, hand hygiene, and document if required. So a lot of skills are hand hygiene, then done, but some skills and your state will let you know which skills require documentation. Some skills have a documentation, so you would hand hygiene, then document, then be done. Because it's almost like saying, if you document with dirty hands, it's almost like saying you would go into a patient's room, have urine on your hands, and walk out to the nurse's station and grab the chart, which you would never do because that would break infection control principles. So these are the finishing up steps. So you have the beginning and end of every skill, right? So just commit those to memory, and there's these are in your notebook. Now, before we go over skills, this I won't read to you, you'll be able to read on your own. Ambulate with gait belt. Do you require gloves? Yes or no? How many glove changes? List of supplies, documentation, yes or no? This is for students to fill out to help them. I put a script of things to say, safety and infection control considerations, okay? And secure gait belt around the waist. These are things to not forget. It's not a to-do list, meaning that every step by step, For that, watch my YouTube videos, but it's kind of like more important things that you don't want to forget. So if you go through your notebook pages, at the end, there's blank notes. If there's something on YouTube or during your class, or someone says, assist with bedpan, then a blank note page, make an occupied bed, you know, and so side lying. So this one following along with the prometric skills. In the state of Massachusetts, they switched to DNS, and the only thing that's different from Prometrics is that they have a compression stocking video, which I it's up on the YouTube page, okay? So that's the notebook, and so the notebook is super helpful for you to fill it out. Don't just look at it, really take your time. Gloves, yes or no, how many glove changes, and you could have it open to the particular skill as I'm doing that video. Okay, so let me stop this for now, and what I want to do is open my whiteboard to talk about principles of certain skills, okay? Okay, so with the principles, so every skill has a beginning and an end. Beginning steps, finishing up steps. Beautiful. Then you have your notebook. Your notebook, you'll line it up with my YouTube page and write notes. And again, this is a CNA refresher course. So the assumption is that you went to school somewhere. So whatever notes from your textbooks, how many glove changes, things like that. So that notebook, mark it all up, practice and things of that nature. But there are certain principles I wanted to make you aware of, because that is kind of what would get you to not pass. So regardless of the skills, there are principles that you keep in mind. So that's what we're going to focus on right here. Okay. So the principle, safety principles, right? So when anything that you're getting the patient in and out of needs to be locked. Okay. So the wheelchair locked, the bed locked. If you're doing a commode, locked, right? So anything that they are doing has to be locked, okay? Another safety principle are the side rails. When you are done, you have to put the side rail up because the patient can roll out of bed. So that's why your side rails are considered a safety principle, all right? Another safety principle is that when you're working on the bed, you raise the height of the bed for your proper body mechanics. But when you go to leave, you cannot leave a bed elevated. So imagine an 80-year-old with the bed up super high, and then you leave the room, the person can fall out, all right? So that's why the bed has to be low. So these are the biggest safety principles. Another thing that's safety too is if the water, and I have water there, so I'll mention it twice. If the water is too hot, it could be a safety thing. Now, you know, there's safety going along when you're answering the multiple choice questions, but this is now talking about skills. Another indirect principle that they're going to grade you on is your communication, okay? So the communication, are you letting them know what you're doing, okay? And I did say in the beginning steps, that's why you introduce yourself, but are you talking to them throughout, making it a comfortable experience? So imagine if you were bathing someone, took 20 minutes, they're stark naked, and you were in there silent, not a word. How creepy would that be? So communicating and talking to your patient is part of the skill. And so I always tell people, I kind of communicate in terms of telling them what I'm going to do, but in a more conversational, funny tone, see if they would engage with me. So I'm saying, okay, the water's a little hot. Is it, you know, I'm just going to roll you on your back nice and smooth. So sometimes just saying what you're doing is part of communication. How do you feel? Does that feel comfortable? Does this feel comfortable? Let me know if the water gets too cold. Are you ready to stand up? Do you have any pain? So all of those are communication, okay? The next one, infection, is embedded in all of the skills. Now, there are certain skills that require gloves, okay? And certain skills that do not. But for most testing, if you wear gloves for a skill that doesn't require gloves, they won't penalize you. But if you don't wear gloves for skills that do require gloves, you will get penalized. Does that make sense? So with the gloves, you have to think of universal / standard precautions, okay? And so if you are about to engage in body, blood or bodily fluids, so that is your bed baths. These are skills that require gloves. Bed baths, perineal care, okay, catheter care, emptying of a Foley drainage bag, right? Emptying a drainage bag. What else? Emptying a drainage bag. I'm trying to think of all of the skills here. Yeah, ventilation. It could be sometimes feeding. Bed making an occupied bed. And I think you'd have to go through it. But I believe those are the majority of them. Wheelchair doesn't, out of bed ambulation doesn't. So we have making an occupied bed. For nail and foot care, so then you have denture care requires gloves, okay, mouth care. So then you have nail and foot care. Sometimes a tricky, I tell my students to put gloves on because it'll say something like, only wear gloves if you think you're going to be exposed to an open area of their skin. But I say, how do you know? Like, you're not aware if they have a cut on their foot or their hand. So nail and foot care, I would put gloves on. Okay. All right. So that's gloves. Infection control also, I mentioned to you with the hand washing, the difference between your person and the sink. When you are under infection control, when you're folding the linen, and you'll see in my videos, you have to make sure items are not touching your person, right? That's how infections go from room to room, because the patient is not up going into another patient room. You are as the CNA. So you can't keep touching all the soiled linens to your person, to your body, and keep walking from room to room. Okay, so that's those principles. Another principle here with water is that any skill that has water, which has a lot, you have to check twice. And so what does that mean? That means when you fill it up with water, you check it with your hand. Some states require you to check a thermometer. Massachusetts doesn't require you to have a thermometer. You check with your hand, and then you have the patient check it with their elbow. And that is even if you change the water. So for example, perineal care, you go in with water and then you change it to do the backside. So when you first fill it up with water, the basin, you check twice, but when you go out and change the water, you check it twice again. So just because you checked it the first time, if you change the water, you have to check it again. So that's the number one thing with the water. Linens, any skills that require linens. So I hope you see what I'm doing here. You're going to go through every skill and use the notebook and use my YouTube page for all of the skills. But here the principles is that any skill that you get, these are just flagging items for you. So linens, again, there's always a way. The biggest thing with the linens, they don't touch your body. If they fall on the ground, you replace it. And the biggest thing for making an occupied bed or perineal care, anything that you're rolling underneath the patient, when you go on the other side, you want to make sure that you don't cause friction and shear, okay, which would damage their skin. So I'm just going to say, don't cause friction. Okay, so you don't cause friction and shear. The hand washing we talked about, you hand wash for 20 to 30 seconds, the happy birthday song. There are items that require documentation. If it requires documentation, you always document with clean hands. And you always sign and date. Sign, date, and time, okay? So your testing location will always have a clock around. So you can know the documentation is not good if it doesn't have the date and time, okay? Because you don't know when it was done. Now remember, in healthcare, if you didn't document it, you didn't do it. Okay. And then the last big principle I would say is body mechanics. They're testing to see how you move the patient's body, how you handle their person, that you don't cause them harm. And they're looking to see how you move your body so you don't cause yourself harm and go out and get workers' comp and all of this. So with the patient, when you watch my YouTube videos, you will see that I have, when you're moving the extremity, there's places you hold them, like at the wrist. You're never pulling and tugging. You can dislocate shoulders. You can cause a skin tear. And so the way you lay your hands on a patient, but again, I'm very explicit in my YouTube videos. And so definitely watch those and pay attention to that. And then your own body mechanics is not your back. That is the base of your, body mechanics. It is your lower body, so like the squatting. So make sure you look at your body mechanics, and anytime the patient has a skill that's in the bed, they don't really want you bending over a patient unless it's a skill like getting them out of bed to a wheelchair. But anything you're doing for them, they'd rather you raise the bed to your height, which is like waist level, so you're not bending down, okay? So those are the biggest principles, all right? So what you're going to do, I'm just gonna write the steps for you here. Steps, you're going to go to my YouTube page, like and subscribe. As you watch videos, have your notebook out. Follow along and fill in, okay? So that's going to help you. 3, you're going to make flashcards of supplies for each skill. Okay, so you'll see like how many towels, washcloths, and things like that. And it may seem a little bit tedious, but as you watch the notebook, like once I hold one washcloth, just say 1, 2, 3, definitely, so you can follow along. And that will help you, because don't forget, you have to gather your supplies. If in the exam, you realize you forgot a supply, it's not that you failed, but you've actually made more work for yourself, because you have to lower the person into a safety position, meaning the bed low and locked, call light within reach, you have to hand hygiene, go out, get the supply, and then come back in. So again, you didn't fail, but you just made more work for yourself, okay? And so then 4, what you're gonna do once you have that, come back, watch this principles, and make sure you apply that. So a lot of things to practice, a lot of things you could do at home. You don't have to run out and get a wheelchair or get a bedpan. There was a wife who put her husband on a skillet as a bedpan, right? Or get someone out of bed to a chair, right? But every other thing, like brushing the teeth and feeding and making a bed, you have those supplies at home. So practice makes perfect. Now, some tips I want to tell you when you go to the state exam. 1, again, remember I said, if you make an error, it's not a failure. You could correct it in real time. There are some skills that don't take a lot of time. So let's talk about the pulse rate and the respiratory rate. If you're not confident in that number, and I tell all my students this, just say, I want to do it one more time, because you remember, you only count for a minute. So you have about 8 minutes, 9 minutes for each skill. So you have more than enough time to simply take the pulse again, or take the respiratory rate again. The longest of all of these skills is a bed bath, right? and then probably making an occupied bed. So every other skill you can just correct in real time. If you drop a linen, don't act like the evaluator didn't see it. Just lower the bed, lock it, and go get the new linen, a new supply. Pulse, if you don't trust the number, do it again. Respiratory rate, if you don't trust the number, do it again. So there are a lot of things you can just fix. All of the skills that have a left or right side. So let's talk about that as we conclude the video, so you can point that out. I'm gonna put left or right. So dressing a client with a weak arm has a left or right side. And then all of the range of motions have a left or right side. So if you realize you stood on the incorrect side, on the wrong side, you should just say, let me do it again, okay? So basically how most testing works for all of them is that if you still have time, before you say done. So once you say done, it's over. But if you have the card in your hand, you're like, oh, I stood on the right side instead of the left, just say, I stood on the wrong side. I'm gonna go back in and do it again and do it again. They will, of course, let you know if your time runs out. But like I said, there are 2 skills that are really long, but some other skills are not that long where you actually have time to correct your mistake. Okay, so go over all of the skills. And I know with these principles and with the notebook, you're going to do well. All right, take care.